Okay, this is our first panel. We've got a mix, clinicians, medical device, tech transfer, data scientist, particle physicist. So I'll let each of my panel, you've heard me talk enough so far. I'm going to let each of the panelists introduce themselves, tell you a little bit about themselves, what they're doing, how they see the future and transformation of healthcare from their view, and then we'll get into a dialogue. Jay, if you want to start.
All right, thank you. Should I go to the podium?
You can sit there, go to the podium, either one.
Can everybody hear me? Well, thanks very much to the NOS Entrepreneur Center and for Dr. Ramshaw inviting me to speak today. There's a little blurb about me in the program if you really want to see more of my background. But my name is Jay Crawford, and I wear several hats. The first hat I wear is that I'm a practicing surgeon here in town. I work at NOS Orthopaedic Clinic, and I've been in practice for about 20 years. And when I say that I'm a practicing surgeon, I will tell you I did 6 operations yesterday. I saw 20 patients in clinic this morning before coming over here, and I have 25 patients waiting on me in my clinic when I finish. So I am neck deep in healthcare and have been every day for 20 years. I'm also a software developer, which you gotta think that sounds pretty weird. How many people do you know that work 65 hours a week as a doctor and then build a software company? There's gotta be a story behind that, and there is. The story is that as we started moving into this value instead of volume direction about 10 years ago, this started creating huge problems, which maybe are invisible to you from your perspective, but I can tell you from my perspective and the perspective of people who do what I do across the country, this started creating massive problems. And I saw a problem that no one else was talking about, no one else, I could find anyone working on it, and so I decided that this was my moment to try and fix my own problem. So I spent a bunch of money and built some software to fix my problem. And when it not only fixed my problem, but really had about a 400% value over what I was anticipating, I realized that this is something that I needed to expand out and build a company around. And of course, we've done that, and now we're in 26 states and thousands of surgeons that are clients, and hospitals and non-surgeons. So from my perspective, volume to value has been designed by people who neither take care of patients nor really use the healthcare system as consumers. For example, let's talk about Jonathan Bush. I'm sure he's a great guy, former CEO of Athena Health. Mid-50s, no apparent medical problems. I doubt that he's been to a doctor since he got his 10-year-old immunizations. So what does he really know about the healthcare system? I would bet not a lot. Not from the perspective of the consumer. He's also not a provider and not a physician, so he doesn't know much from the provision side. What is he? Super well politically connected and very wealthy, and has a company, had a company, Athena Health, that he built into a massive healthcare company, underwritten, of course, by governmental policy over the past 10 years. What I have seen from my perspective is that giant policy changes that are created from the top down create massive gaps in execution at the ground level where we actually take care of patients. Because as Bruce was saying in his talk, the perspective from the top down completely misses what we do in clinics with our patients in our operating rooms every day. And these gaps that are created is really creating an opportunity for people like me who are entrepreneurs at the ground level who can start things and start trying to move things in a more sensible direction than what we've done. So enough about me and what I'm doing. The big thing I wanted to challenge today, and many of you might find the things I say heretical, and I'm totally comfortable with that. As an entrepreneur, I'm very familiar with telling people things and having them look at me sideways and say, "You are insane." I have gotten over it. Okay? But I've got thousands of customers who have vetted what I'm saying, what I'm doing over the past 5 years, and we're doubling in size every 6 months. So I will tell you that there are other people out there who see things the way I see them. When you start with the equation value equals quality divided by cost, and you think that you're going to apply that to the country and get something meaningful out of it, I would tell you that that is meaningless, completely meaningless. I put no stock in that equation. And that sounds like I'm contesting Newton's force equals mass times acceleration. How could you possibly say that that is not working? Is that not right? Well, I'll put it to you this way. Quality over cost, you could restate that as value is what I want divided by what I'm willing to pay, right? Mm-hmm. So whose value? Who is the I, right? Are we going to assume that they're talking about the patient when they're talking about value equals quality over cost? Is that the value we're talking about? The answer to that is no, and I'll prove it to you. Healthcare is not a monolithic entity. Healthcare is transactional, like everything else that we do. Service is provided, person is paid, or entity. Compare this to any other transaction you might go through. Let's say you're going to buy a car. The consumer has a different value proposition than the person selling the car. The reason the person got up that morning and came to work to sell that car was really not to make that consumer happy. That may be part of it, but he's got a family to feed. And his value proposition is extracting money from that consumer to pay his overhead and to move these cars so he has a good reputation with the car maker, etc. The consumer's value proposition, totally different. The consumer may be looking for performance or reliability or luxury or a certain price range, etc. Totally individual. They can get together and decide that their shared goal is to move a car and get the car from the dealership onto that person's driveway. But the way they get there, all the details are completely individual. The value proposition for each person in that transaction is totally different. So if value equals quality over cost, and we've been discussing, well, maybe they're talking about the patient there, I would say to you that all of you have some experience with the healthcare system over the past few years. Either you have a medical problem, or your parents, or your child, or your spouse has a medical problem. So you've probably had a little bit of experience with the healthcare system. Has your value gone up over the last 10 years? Remember, the denominator of that is the cost to you. And the entire system has been designed over the past 10 years to raise the cost to you, not lower the cost to you. Patient component has gone up by 500,000% for healthcare. By definition, in that equation, that is acting to lower the value of healthcare to the patient. In fact, what has it created? It's created a massive underutilization of the healthcare system, not an overutilization that we're always hearing about. Too many things are done, too many wasted procedures, wasted tests. That's not really the problem from my perspective. My perspective is that I see a lot of people who are 40 pounds overweight, have not been to their doctor in 3 years, have not gotten a colonoscopy, they're over 50 years old, or haven't been to get an OB/GYN checkup in 5 years. Why are people not going to the doctor? Two big reasons. It's still enormously inconvenient and painful as a consumer. And secondly, it costs a lot of money that most people now really can't afford. So value equals quality over cost certainly is not aimed at the patient. If it has, we've got the least effective, most counterproductive system we've ever started trying to do over the past 10 years. Maybe it's the providers. Maybe value equals quality over cost is talking about the hospitals or the doctors. I can tell you, as a person who goes through spreadsheets looking at costs of doing business, my bottom line, the denominator of the equation, our costs have gone up dramatically over the past 10 years. This morning in my clinic, I had 7 people follow me around to help me see patients. Scribes, nurses, MAs, secretaries, schedulers. I now pay for 11 people from what I earn. It takes 11 FTEs to support me in my job, and that does not include all the money we've spent on tech over the past 10 years. So I can guarantee you that value equals quality over cost has not been aimed at helping the provider. I will give you the answer. Value has been aimed at helping the payer, who is, unless you work for Blue Cross Blue Shield or Anthem or Humana or Medicare or TennCare in this room, you have not been what this has all been driven at doing. Payers have engineered this process to lower their costs and shift their costs to all of us and to lower their risk. And they hope that there's some quality benefits along the way, but we really haven't seen those, have we? So what I'd like to tell you is that value is a team sport. Let's use basketball as an example. There are, let's say, 5 people on a basketball team. You can build your team around LeBron James, but you can't have everyone on the team be like LeBron James, not just because you can't afford it, because LeBron James needs support of people who have different agendas and different value propositions. If you need a rebounder, not every rebounder that's good in the league is willing to come to your team. It may not be the right market for them. It may not be the right contract structure. It's not just the amount you're willing to pay that rebounder. He may be very interested in how the offense or the defense is designed so that he can get those 11 rebounds a game that he needs in order to get his next contract to be better. So while everyone on the team, the coaches and the administrators and the players can all have a similar grand strategy of winning a championship, at the practical level, that means nothing. That's maybe in everybody's top 5 priorities, but everyone else's priority is take care of my family, ensure my future, and get the things accomplished that I need to get accomplished. And that's really what healthcare is. And failing to recognize that leads to this giant monolithic thing that we've done for the past 10 years. The only way to get full alignment between every player in the healthcare system would be for us to switch to an autocratic dictatorship like North Korea, where Kim Jong-un says to the doctor, fix the patient or I'll kill you. And says to the patient, do what the doctor says or I'll kill you. Well, you've got full alignment. No one wants to die. Everyone's going to do what he says. We're not going there. This is the United States, and we're going to continue to recognize that everyone has their own value proposition, and a system needs to recognize that differentiation. So let's go back and look at these key promises and initiatives that we've been going through for the past 10 years to try and increase value by increasing quality. How about consumer ratings, right? Everyone sees health grades and vitals.com, et cetera. It's a great thing, right? I can tell you that from a provider's perspective, I almost say to people when I walk in the room, what do I have to do today to get 5 stars from you? Is that really what you want your doctor thinking about when he's seeing you? Or do you want to think about your medical condition and what's best for you? I can tell you if the patient says, I really want 100 hydrocodone tablets in order to give you 5 stars, now my incentives are perverse, right? But that's what happens. Why do you think we have this opioid crisis? We are trying to make patients happy, sometimes at the expense of their actual health. How about the increased patient component? We talked about that, right? Making patients pay more was ostensibly designed to give them more of a stake in their health care. I would tell you that what it's done is it's led to massive underutilization of the healthcare system. How about programs like, I think that Bruce was talking about, PQRS, MIPS, BPCI, advanced BPCI. All of them are supported by numerous studies showing that they do not increase quality. They shift what people are searching for. When you do a whole bunch of hip replacements on people and you get penalized if someone gets readmitted, guess what you don't do? You don't readmit them. So guess what happens? Mortality rates are up, not down. None of these programs have actually improved quality in any kind of a measurable way from every stakeholder's position. How about EHRs? Meaningful use. We went back to discussing Jonathan Bush and Athena Health, Epic, things like that. What were those huge software packages designed to do? What were they promised to us to do? Well, they were promised to lower errors, medical errors, increase population health, and increase the sharing of medical info. And they have done none of those, absolutely none. They are totally siloed. I had a physician from Colorado call me about a patient yesterday who was admitted to their PICU, and I had to take cell phone pictures of his images and send them to him on his phone because NextGen does not talk to Epic at all. There is no transfer of information, and they will not let it happen because that is their value proposition. So what did a medical note look like 50 years ago, and what does it look like now? Well, I mean, even Hippocrates, when he wrote his medical notes, maybe 3 or 4 sentences, he wrote out longhand what the patient told him, what he saw, what he thought was the problem, and what he was going to do to fix it. And he organized it and kept it so that he could remind himself what was going on the next time he saw the patient. And medical notes were pretty brief and pretty specific and really very helpful to the person who used them. Okay, so I took care of another patient yesterday who came from Michigan for follow-up of a simple problem, and the medical note that was faxed to us was 8 pages in length. 8 pages in length. Now, some of that is due to the legal environment. right? So we went from just documenting what we thought and what we saw and what we did to documenting the things we didn't think it was, the things we didn't think need to be tested, and the reason why we didn't need to test them, really to protect ourselves from liability. That was the first big thing that happened. But then medical notes went from 2 pages to 8 pages when EHRs came along. And I will tell you that these notes are unreadable to providers. You get an EHR note, just the next time you go to a doctor, ask for your medical note and see if you or anyone in your family can make any heads or tails of what actually happened at that encounter. They're meaningless. The reason why those notes look that way is because we are paying doctors to create those notes because that is how they get paid. Filling in those bullets, meaningless bullets, 8 pages in length for a simple 5-minute checkup. So to conclude, I will tell you that I'm a skeptic about everything that's happened over the past 10 years from a healthcare concept. Concept of value in healthcare that we've been sold, in my opinion, is a magical, monolithic mirage. From one perspective, it may appear to be a beautiful city street with nice homes, but from any other perspective, it's revealed to be a movie set. Raw, unpainted lumber and scattered detritus behind fancifully painted facades. Healthcare is actually made up of millions of unaligned individuals and entities that are battling for survival and their own personal value proposition. And this will not change. The way forward will not spring from the central planners with their own agendas and marketing budgets. The way forward will come from people like you see in this room. Active participants in the healthcare system who know their own story in their own local market and who understand what the real problems are. The small entrepreneurs will test crazy theories like the ones I started with 5 years ago that seem on their surface to make no sense, but will build the solutions that lead us to success. And that's what I have found in my experimentation in this field. Thank you very much.
I am not following that. You're going.